Living with a chronic respiratory condition doesn't mean giving up the things you love to do. At BluZone Health, we're here to help you breathe easier and rebuild your strength. Our online cardiopulmonary rehab program offers tailored exercises, self-management training, and expert support from certified respiratory therapists. Accessible anytime, it's designed to reduce breathlessness, improve lung function, and empower you, all while connecting you with a supportive community. Visit bluzone.health and take the first step towards stronger lungs and a healthier future. BluZone Health. Breathe better, live better.
Hey everybody, welcome back to the Cozy Lung Lounge. We're here with a really important episode. It is all about medications, what kind of medications you need. I've got a couple of friends here with me. Kelly.
Hi, everybody.
And a new friend, Matt. I don't know if he's showed his face on the podcast before.
My first time. I'm excited.
We're glad to have Matt here. He's going to talk to us about rescue medications versus maintenance inhalers. When to use what and why. It's really important to take the right inhaler at the right time. You may have 3 or 4. And Matt's going to talk through all of those reasons why.
Matt, why is it so important that people understand their inhaler types that they have? I talk to a lot of patients and I ask them, what inhalers do you take? And they say, well, I take a red one and a yellow one and a blue one.
Then I try to narrow it down. Is it a disc or a pump? Then we can start there. Oh, no, I twist it. They're like, okay, we're on a Resp, Matt. Let's go there.
But why is it important for patients to know the difference?
Because different inhalers do different things. You know, you've got your rescue inhaler, which is designed to help you when you are having that attack, whether you're feeling the chest tightness, shortness of breath, wheezing, or coughing even. And your maintenance inhalers are the ones you take every day to prevent those symptoms from being triggered. We want to know when to use it and why to use it. So it does the best for that medication. I had a patient at one point who came in and she was on Symbicort and she was using it as a rescue inhaler. So sometimes she was taking it 16 times a day and she was wondering why her pharmacy was not refilling it.
I used to tell my patients, go out, buy a giant Sharpie, and for your maintenance ones, the ones you take 4 times a day or 2 times a day, put a big giant M on them. And then for your other one, put a big giant R on it so that you don't mix them up.
And if I remember, doesn't the Asthma and Allergy Foundation have printable things for stickers you can download or send out to put on your, and I think the COPD, I know Right to Breathe does at sometimes. But I know a lot of advocacy groups offer those as well.
Some of these, you talked about Symbicort particularly. Sometimes that's used as a rescue and a maintenance medicine. Is that right?
I've never seen it used like that.
Oh my gosh. This is called SMART therapy, single maintenance and rescue therapy. And it only works with a couple of different kinds of inhalers. And Symbicort, the ingredients in Symbicort are one of those, and the generics are fine. And you can take up to 16 puffs a day. But what you're going to do is use your asthma action plan to guide that. And so if you start getting into that yellow zone, you can take some extra Symbicort. And what that does is for people living in the cornfields like us, it gets more steroids on board at the time that the patient needs it.
Well, the point is, I think if you're hitting on your inhaler 16 times a day, you need to let somebody like your doctor know.
It should be in your action plan. You should be following your plan.
Absolutely.
So as we talk about like rescue inhalers, what are our main ones? Are Albuterol, and then of course Xopenex, which I know Xopenex isn't used as much as it used to be, even though it is a generic now. But a lot of patients with heart conditions will use it just because it doesn't have the beta-2 agonist, which is the part of the drug that helps make you feel jittery and causes the increased contraction of the heart and the strength of the contraction. So it's an option if you get a little too jittery with Albuterol.
I know I had a lot of patients that were on Xopenex and it worked really well for them. And then for whatever reason, their insurance stopped, whatever, their doctor switched them back to a different actual beta agonist, and they were miserable. They just felt like, okay, my lungs opened up, but now I just feel like my heart's going to jump out of my chest, and my head hurts, and I want to go back to my my levalbuterol. And I think for anybody, if your doctor changes medications, your insurance says we're not paying for that anymore, there's a newer, better drug for you to try, and it's not doing it for you, it's not newer and better for you, let your doctor know and say, I want to go back on what made me feel good, because that's the whole point, is that you feel like you can go and do the things you want to do.
Part of being your own self-advocate is being a little mean sometimes to get what you need.
Now, I have a lot of people taking some of those Combivent soft mist inhalers. Are those used for rescue?
Yes, they are a mix of albuterol and atrovent. I'm not sure if it is approved for asthma or it's just approved for COPD. That's something I know when you look at FDA approvals, that's real if your insurance will pay for it or not. I know at one point they tried me on Spiriva, but the doctor had a sample of Tadorza, and the Tadorza worked awesome, but it doesn't have an asthma diagnosis. So I had to switch back to Spiriva, and I ended up coming off of it because I switched biologics, but it helps. So Gina, did you know if that, I'm not sure, is that approved for asthma or not?
The asthma treatment does use ipratropium in a lot of that as maintenance medicine, not necessarily for acute, but if you have the Combivent, you can use that as your rescue.
I know when we move on to our more maintenance inhalers, you've got LABA, long-acting beta agonist. You've got your LAMA, which is your anticholinergic drugs. Then you've got your ICSs, which are your inhaled corticosteroids. Then we can start getting into a little bit of the mixes. That's more for your COPD patients when you mix your LABA and LAMA. I know for asthma now they are approving the triple therapies, which is a LABA, LAMA, and ICS.
I just want to back up a second, and I just looked this up really quick. Duoneb is not approved to treat asthma, and neither is ipratropium by itself. That's considered an off-label use for asthma. But going back to the point, like Matt said, if you find something that's working well for you, just because your insurance says, no, we're not going to pay for it, doesn't mean that you can't have it. You may have to pay out of pocket, and there's all kinds of resources you could find to help you pay for it. But I feel like one of the things I tell my patients over and over again is use what works for you. Why are you settling for, 80% of a great day when you could be having 100% great day?
In shifting, there's as what I said just a little bit ago, every one of those drugs has so many different options. For instance, like your LAMA, you've got Spiriva, which is tiotropium. You've got Anora. What is it? It starts with a U. I can't remember exactly off the top of my head. You've got, and then you've got Tadorza, which I'm not sure what the actual drug on that one is as well.
We might want to guide the users to a special resource from the Asthma and Allergy Foundation that has all of the upcoming, all of the most recent inhalers for 2025. We can put a link on that in our show notes.
And then now there is an actual nebulized version. As we look at different inhaler types, it's also cognizant to think of the delivery device of that inhaler, what works well for you. Whereas, you've got an MDI, which is a pump. It's easy, small, you can carry it with you everywhere. The one downside is you have to have the coordination to time breath pump. You can use a spacer in there, which we can talk a little bit about spacers in a little bit. The next are DPIs, which are dry powder inhalers. Those are a little bit better for the timing of the breath actuation because you just click it and you breathe in when you're ready. The downside of some of those inhalers is some of them have very high inspiratory flow capacities for you to be able to get the medicine deep into your lungs. So, really when you get put on an inhaler, your doctor's office should really have someone sit down and find the right inhaler. What I always say, the number one thing is, can you afford it? Because if you can't afford it, you're not going to get it. So, but after that, we need to find what of those different types of inhalers, what works best. for you, whether it be the MDI, DPI, or the SMI, which is the soft mist, which is the Resp mat.
Now, one thing you might wonder is, how do I know if I'm getting enough? Well, one thing you can tell is if it's crunchy or not. If your inhaler is crunchy, of a dry powder inhaler, you're probably not getting the powder out. Is that right?
Yep, and also the DPIs can be affected by humidity. So if you live in high humid areas, that dry powder can clump. So that's another thing. If you're not getting crunchy or clumps, it's not going to get deep in your lungs, because that drug is put into a certain size of particle, so it inhales well through the filter there on the inhaler.
While we're talking about that sort of thing, what to watch out for, when you have a 95-degree day, don't leave your inhaler in the car. That needs to come inside where it's cooler, or put it in some sort of cooler bag.
Yeah, and every inhaler has like a specifications in it to what temperature it needs to be stored at. So if you open that up and look at it, it tells you how to do that. And there are also all resources online. The COPD Foundation, BluZone, actually has YouTube channels where you can go to any inhaler, look at it, and watch a video how to do it to make sure you're doing it correctly, which I'm sure we'll get into technique a little bit later on.
I use those BluZone handouts every day for patients. They can be printed on demand right from the website, even saved to your own device if you need to use it frequently.
I always like it when my patients demonstrate back. I know that a lot of patients, we tell them, oh yeah, just go, watch a YouTube video, and that's good. But I always like to have the patient, take a puff for me, just so I can make sure you're getting the deposition all the way down where it's supposed to go.
I had a really good question from a patient this week during the PFT. Maybe one of you can answer it. Can you put 2 puffs in the air chamber, or must it be 1 at a time?
To be honest, I don't know if I've ever heard that question. That is a good one.
I've heard that question a lot, and the answer is actually, if it's an MDI, no, because the MDI needs to regenerate with the propellant in between puffs.
That was my thought, because I think it gets too cold from the propellant to actually deliver that medication out, and you need to give it at least 30 seconds to.
Yeah, the first puff will be albuterol, the second puff will be propellant.
Which sometimes can cause a reaction.
Definitely.
Hi, I'm Kelly, a registered respiratory therapist with BluZone Health. Do you feel breathless much of the time? Are you unsure of how to manage your breathlessness? Is it keeping you from doing all the things that you would like to do? I'm here to help you learn to work with your healthcare team to come up with a plan that will work for you. There are lots of tools, tips, and tricks and breathing exercises that you can do now that will help you breathe easier and more effectively. I look forward to joining you on this journey and empowering you to breathe better.
We've established there's so many different kinds of medicines that we can't all talk about here at one time. You said, number 1, we want to be able to pay for it. So if you go to the pharmacy and it costs too much, ask the pharmacist if there's a similar medication under your insurance plan. Number 2, it's got to be convenient for you to take with you. And number 3, it's got to match your symptoms, I'm guessing.
Yeah, it's got to be what the diagnosis has to be approved, so your insurance does pay for it. What is nice now is there are some generics that are coming on that I think out of pocket are only $50 without insurance.
That may not apply to you if you're Medicare or on a certain insurance or Medicaid. So you'll have to check with your insurance company what the best deal is with that.
Yeah, absolutely.
Several major pharmaceutical companies, including AstraZeneca, Boehringer Ingelheim, and GSK, have implemented a $35 monthly cap for many of their asthma and COPD inhalers. And the list of those inhalers is Air Supra, Resp, Breztri, Symbicort, Atrovent, Combivent, Spiriva, Stiolto, Straverdi, Advair, Anoro, Ellipta, Arnuity, Brio, Incruse, Ceravent, Trelegy, and Ventolin. That's a lot of medications to choose from. So
I don't think it's gone into effect yet.
Okay.
But I also believe it excludes Medicare, if I remember correctly. But, as we look at, I think everybody that I've worked with is being shifted to those triple therapy inhalers, which the only 2 on the market currently are Breztri and then Trelegy.
I don't
go
know. Did
ahead,
we talk
Gina.
about this, Kelly, on the asthma episode that yeah, we did. When many asthmatics, lifelong asthmatics, particularly if you're poorly controlled, you will probably go over into COPD at some point. And they call that asthma COPD overlap syndrome. So at some point you may want to go from dual therapy to triple therapy.
And I do think also the LAMA is approved. You can do a half dose. The only LAMA approved is Spiriva.
So the number one thing you've got to watch is, how do you take the inhalers? One's a twist inhaler, one's a Respimat, one's a disc inhaler. I mean, there's so many kinds.
Yes, that's when you hopefully your pulmonary office has a respiratory therapist that walks you through it, because they are very confusing. If not, use resources, the COPD Foundation, BluZone, they all have videos online if you can't. And I think if you go to the manufacturers, they all have videos as well on that inhaler type that will help.
Yeah.
But if you're having trouble doing it, I would ask to change your inhaler types, because, like, for example, if you look at a LABA and ICS, I bet there's 10 of those.
What about nebulizers? I know there's a few different kinds of nebulizers out there.
Yes, you have a jet, which is the compressor that plugs into the little capsule. You've got a mesh, and then an ultrasonic. The mesh and ultrasonic are very expensive and usually not covered by insurance. You can buy them. Actually, one of the companies that made them no longer makes anymore. Respironics stopped making theirs when they got rid of all the BiPAPs. There is, what is it called?
Probably PARI, Peri Neb. There's also one by Monahan. I just love one by Monahan called, so a breath actuated nebulizer only nebulizes on inspiration, so that when you're talking, it doesn't waste it. Then you breathe in, it doesn't, and then you take it out and you do your coughing or whatever. So that's a different kind of nebulizer that only inhales on inspiration.
If you do shift to a jet or a mesh, it can drastically increase the amount of medication you get, because it disperses it so much better. So it's always good to check with your doctor and let them know what type of nebulizer, because I've seen a lot of people buy these off Amazon. And I know a lot of the newer drugs, they are, especially for cystic fibrosis and pulmonary hypertension, they have their own nebulizers, because that medication needs to be a very specific particle size. So that would be something I would caution of people buying, an Amazon nebulizer from God knows where, because you don't know the exact particle size it does. So it could affect how much medicine you're getting.
Why does the particle size matter?
One, if it's getting in your lungs, and it can also clog the filter as a jet nebulizer, it sends air up where it hits a little bubble and it sprays, causes a little pressure gradient, and it sprays everything into a mist. Whereas if you have a mesh, it's a vibrating mesh that breaks that liquid up into small particles. Depending on the drug, it may clog that. Like a perfect example of that is tobramycin. They clog those things up and will burn through that very quickly. And then the ultrasonic uses sound waves to break it up. But certain medicines need to get to certain areas of the lungs. Like if it gets too small and goes too deep, you go past where the smooth muscle is on the lungs, so it's not really going to do anything.
That's a good explanation, Matt. I'll tell all the listeners, it's a Jeopardy question. It's 3 to 5 microns is your optimal particle size for a nebulizer. So if you're ever on Jeopardy, or if you're in a respiratory therapy sputum bowl, you'll have a good answer.
We talked a little bit on the last episode also about side effects. What are the side effects from all of these different inhalers, and what happens if you start experiencing funny side effects?
Of course, always, if you experience a funny side effect, make sure you call your doctor right away. And it really kind of depends on the drug. Like your inhaled corticosteroids, if you don't rinse your mouth after that, you can get what's called thrush, which is like an infection in the mouth. Like we talked a little bit earlier, for your rescue inhalers, most of those are some form of a beta agonist. which can increase heart rate, how hard your heart contracts. So it can make you feel kind of jittery, lightheaded, or that way. The option in that is to go from albuterol to levalbuterol, or from, what is it, Ventolin to Xopenex are the drug names. For the LAMAs, I think about the same, a little lightheadedness. I think there's some nausea in there that can happen, and a very small risk of contractility-like issues sometimes, very rarely, like throwing in arrhythmias.
That one's very rare, but if you feel like your heart's doing funny things after you try a new inhaler, definitely call your doctor. And I think headache is another side effect of the inhaled steroid.
Okay, I think also with albuterol as well, because they get that racing heart rate. Sometimes it can cause a little bit of a headache.
Yeah.
Now, there's a lot of side effects of all of these drugs that are put out there. Should patients be scared of these side effects, or are inhalers relatively safe?
I've been on inhalers since I was 6 years old, so I will say from personal experience, they are relatively safe. I've never had a reaction, but I do always rinse my mouth. That is one thing with the steroids: make sure you rinse your mouth and do not swallow, spit it out in the sink. If you're over, 4 times a week, that means your condition isn't controlled well. Is that the right number?
I think it's 3. I think they dropped that maybe 3 to 4 times a week. And we talked about this on the previous episode too. You need to be on some kind of a baseline management routine that keeps you from having to reach for that rescue. So depending on how often you're reaching for that rescue, if you feel like you're reaching for it more often than usual, you definitely need to call your doctor. But I think the number's 3 or 4. If it's more than 3 or 4, or if it's waking you up at night, your asthma is keeping you up at night, you need to call somebody, get a better baseline control regimen going so that you're not hitting your albuterol all day.
Now, if you go from albuterol and you're just really used to knowing how the albuterol opens you up, and then you go to a controller medicine and it doesn't feel like it's working very well, start thinking about other things. It's not going to give you the good hits of bronchodilation like albuterol does, but it's going to give you a much more sustained bronchodilation over the 12 and 24 hours. Can you walk a little farther? Are you a little less short of breath when you talk on the phone? Think of some things that you couldn't do before that controller medicine, and just see, are you doing them a little bit better now after 2 to 4 weeks of it?
Yeah, absolutely. And another thing on your maintenance inhalers, it usually takes time for that to build up and reduce that inflammation. So it is not something people just think it's going to kick on one day, but it does. I think also using a peak flow.
Peak flow will tell you a lot. Get a peak flow meter from your doctor. If he doesn't have them, find out where to get one. But that will tell you a whole lot about what's going on inside of those lungs of yours. So make use of it.
And so since I have a child in school with an asthma action plan, because it's required, and he's on smart therapy, that peak flow is really how we manage the number of puffs of that up every day. So it can be valuable. Now, if you have COPD, the peak flow meter is not so valuable.
No.
Definitely it's an asthma tool.
Absolutely.
Yeah.
I wanted to go back to something that Matt mentioned before about and Gina, we talked about this, about, feeling that hit, right? Taking that albuterol and feeling that relief and feeling like your lungs open up. But sometimes when you switch inhalers, you don't feel that hit in the back of your throat, which tells me, number one, you're not using a spacer, but number two, people say, oh, they switched me from this to the soft mist or to an HFA mist. And so I just don't feel like I'm getting anything. So they're taking, instead of 2 puffs, they're taking 4 or 6 because they feel like they're not getting the medication. So even though you may not feel it in the back of your throat, which you really shouldn't anyways, if you have a soft mist or an HFA, you are still getting that medication. So don't double and triple dose yourself because you're not feeling it in the back of your throat.
What are some easy ways to help us remember our medication regularly?
Now there's so many apps you can get. What I do is when I do my biologic, I set a calendar every 2 weeks. I know it hits. If not, I forget which day I gave it on. I can't remember the next 2 weeks. But using calendar and then alarms on your phones. And I think a lot of the new, there's apps out there. I should have probably looked those up before I brought them up that help. It'll send you a little like SMS notification saying, did you take your inhaler today? Also, I find if you have a morning routine, like you get up and brush your teeth first thing in the morning, set that inhaler right next to where that is. So it's, right in your eyesight.
Yeah. Bottom line is do whatever you have to do to make sure that you take it on time and consistently.
Well, listeners, I know we have left out a lot of things in today's episode. Please send us a message on Facebook or YouTube or Spotify or wherever you're listening to this. We got so many places we're at now, but we really want to hear from you and hear from your questions.
Well, thank you, Matt, for clarifying all of that. There's a lot to choose from. And I think just education, talking to your doctor, having an action plan and putting all that together will really help you and go a long way to help you feeling your absolute best. So thank you for joining us. We'll see you in the next episode.
Bye, everybody.
Hi, friends. This episode of the Cozy Lung Lounge is brought to you by Hoot and Nanny Joy, where your health and wellness take center stage. At Hoot and Nanny Joy, we know how overwhelming it can be to stay on top of your health, especially when life gets busy or chronic illness adds challenges. That's why we've created self-study programs designed to meet you right where you are. These programs are simple, flexible, and packed with tools to help you thrive. And they come with something extra, access to a live health coach. That's me, to guide you every step of the way. Whether it's improving your sleep, learning to nourish your body, or managing stress, our programs combine proven science with practical, real-life strategies. You can work at your own pace, get the answers you need during coaching sessions, and feel confident you're making progress. Ready to take that first step? Visit hootnannyjoy.com to explore the programs and choose the one that fits your journey best. Hoot Nanny Joy, because your health deserves a little joy.